Hello, welcome to ANA community. So far we were discussing about the history of the case history related videos. Initially we have discussed about the chief complaints. This is being followed by the history of present illness, which is later followed by past history, then treatment history, family history, personal history, menstrual and obstetric history. Today we are going to discuss about social history. What actually those particular social history, in what way so this is helpful in getting the or completing the case history as such. When you say about social history, it is something to do with society. Society means the people, group of people having certain common cultural behaviors or certain other common, what do you say, that the dietary behaviors. Some of the some people, some group of people are exposed to certain common environment. Based on that, the people they are having the certain uh, modifications in their diet and lifestyle. So for this reason, so this noting the social history will be important. So this particular section actually gives us the details of social behavioral aspects of the individual. It may be related to living surroundings, where he is residing, etc. Nature of bonding with the either spouse or family members or friends or colleagues or even strangers also. So by noting that, we are in a better position to say about his physical health or mental health or emotional health or social health, etc. that can be assessed. So what are the questions that will be asked in this particular section? These are the different areas where we are going to ask. Nearly around 11 areas are there where we are going to ask regarding the questions regarding the living situation of a person, marital or relationship status, education, social support network, substance use history, sexual history, cultural and religious background, hobbies and recreational activities, financial status, social stressors and challenges, and other relevant social factors. So by noting these, we are in a position to identify the dosha dominance in the individual. When you think about the dosha dominant living situation, what is this particular living situation in the sense? That is saying us regarding the patient's current living arrangements, whether he is staying alone or with family or in any healthcare centers or in any other housing situations, such as the rental colonies or the very high rich colonies, etc. In those situations, let us say, for example, if they are sitting or living alone, his family is living in some other place, probably this may have an impact on one's physical strength as well as the emotional strength also, because the family members will be supporting that particular person in terms of his diet, etc. So in that way, they may have physical stress or mental stress, etc. Whereas living with the family, so it will be having a different set of the uh, physical problems or mental problems, etc. Healthcare centers, for example, if they are living in mental asylums, definitely we are going to say that the person is having the manasika dosha involvement. There may be a possibility of rajo dosha dominance or tamo dosha dominance, or any housing situations where this particular housing colony is located. Whether is it located in a slum, naturally that may be responsible for the breeding place for the mosquitoes. So that means that may be a possibility of a outbreak of Janapadodhamsa or epidemic in that particular locality. In that way, the living situation will be helpful in determining the health status of the individual. In that particular situation, outbreak of the any kind of the infections, etc., we are going to see the dominance of Pitta dosha in that particular individual. So in this way, this living situation will be helpful in giving us the overall social well-being of a person. Next, coming to the relationship or marital status, whether he is single or married or divorced or separated or widowed. If the person is 50-year-old and he is single, naturally, so that may have an psychological impact, wherein the in India it is being said that family means, so that has to be a couple, male and female. In that way, if he is single, he will be having the psychological stress in this particular regard. Divorced in the sense, so that will be having a different set of the psychological stress. That means there may be a possibility of, in those situations, specifically manasika dosha involvement may be observed, but that too, it will be rajo dosha dominance that will be present in that. Suppose if the person is continuously consuming the pitta rasa or katu rasa ahara in excess in these situations, naturally there will be the affliction of a sharirika dosha, that too pitta as well as vata dosha vitiation may be observed in those situations along with rajo dosha involvement. Regarding the third aspect, education, patient's educational background, whether he is illiterate or illiterate. In case of the illiteracy, the patient may not be in a position to identify what is good or what is bad. Of course, he may be having certain skills, but he will not be having the overall the stress on maintaining the health as such, that will not be given by the illiterate person itself. And any vocational training, any specific training, for example, if a person is a singer, he is actually giving the, what do you say, the training to the students for the singing, naturally he will be having the affliction of vocal cords in due course of time. Naturally, which may be having a vitiation of vata dosha in those situations as such. And regarding higher educational degrees, what kind of the degrees as such? For example, if a person is doing a PhD, so when the PhD work starts, definitely he has to work day out, day in and day out, so that his sleep pattern may get disturbed, which is again resulting in the rajo dosha dominance as well as vata dosha impairment. In that way, so educational status may have an impact on the social well-being there. Whereas social support network, in the sense, what kind of the support system he is having. Strong support system, that means for each and every problem faced by him, his family will be there to support him. So that means he will not be having that much mental stress as such. Whereas in case of the absence of such a support, they may have manasika dosha affliction, that too rajo dosha involvement there. Substance use history. That means what kind of the substance is the person is using. Alcohol in excess, that will be having an impact on liver. That means he may have pitta dosha dominance in that particular situation. Tobacco use, excess tobacco use, in case of the gutka, etc., it is specifically seen in the oral cavity. Definitely, vata dosha dominance may be observed in that particular situation. Suppose if the person is having the manifestation of the cancerous growth, then we are going to say the tridosha dominance can be observed in that particular locality. Suppose if the person is taking the cigarette as such, cigarette smoking, naturally that will be having an affliction related to respiratory tract as such. As far as other narcotics as such, if the person is taking the injections, etc., naturally they may be resulting in the what do you say that the uh, clots formation on those areas where he is having the injection of these, what do you say that the narcotics, etc. In that way, substance use history will be giving us the health status of the individual. Coming to the sexual history, what kind of the sexual history the person is saying, whether he is having any kind of the normal sexual behavior, or that is vaginal intercourse as such, or some other abnormal sexual perversive behaviors are there or not, and any kind of history of sexually transmitted infections are being present or not. In those situations, if there is a history of sexually transmitted infections, definitely we are going to see the dominance of pitta dosha in the body there. Regarding the cultural and religious background, what kind of the practices the person is or the patient is doing. For example, in the month of the Nagara Panchami, etc., or in the month of what you say that the Ganesh Chauthi, etc., we are going to prepare the specific dish called modaka. So this particular modaka, actually that is being baked and that is being served later. In that particular situation, we are going to say there may be a possibility of a pitta dosha vitiation if the baked item, if that is being consumed frequently. There are certain situations, some of these people, they are having the allergic to jaggery also, wherein in case of the modaka and in case of the other dish as such, it is specially being prepared in the celebration of Nagara Panchami. In that particular situation, jaggery is being used. Some of them they may have the what do you say the allergic skin reaction to those aspects, jaggery. Some of them they may have burning sensation, etc. In that particular situation, we are going to say pitta dosha dominance or pitta dosha initiation has taken place at that particular time period. Regarding the hobbies and recreational activities, what kind of hobbies the person is having. For example, if the person is having the hobby of seeing the movies at late night, only after the 12 or 12:30 the person is sleeping, that is considered to be responsible for the increase of the vata dosha in the body. Suppose if the person is having the habit of consuming the samosa every evening, definitely that may be having an impact on pitta dosha initiation in that particular individual. So like that, hobbies and recreational activities will be helpful in determining the health status. Regarding the financial status, what kind of the employment income, insurance coverage, and any financial challenges that may have an impact on the patient's health. That too, it will be usually related to the psychological as well as emotional distress. That means the person may have the increase of either Rajo dosha or Tamo dosha in the body. Social stressors and challenges, such as recent loss. Some of the family members are being lost. Definitely, that will be having a psychological impact. So, and other relevant social factors, such as military service or involvement in the criminal justice system. They will be always under stress. That means there may be a possibility of a Rajodosha dominance. In that way, the social history will be helpful in determining the social well social health of the individual. Take home messages from today's discussion, that is, the social history actually gives us the details of social aspects of the individual or patient visiting the doctor. Here we are going to see the living surroundings or nature of the bonding with the friends and family or other strangers, etc. We can able to analyze by accurate inquiry. This one will be helpful in assessing the living environment of the individual. Dear ANA members, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one topic that you'd like to hear in the coming videos? Mention in the comment box below. If you are liking this particular video, then put a thumbs up and spread this particular video to maximum number of 2 Ayurveda learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.